Welcome to the Health and Safety Orientation for medical students. We'll be covering a couple different objectives today, the first of which is to increase knowledge of common infectious and non-infectious travel risks, many of which are listed below. And the second major objective is to learn steps you can take before and during travel to stay healthy and safe. If you haven't already, I would highly recommend that you make an appointment for a pre-travel consultation visit. At that visit, you'll be discussing things like immunizations, prescription medications, and then discuss other counseling and advice. Your travel risk is obviously vary depending on where you go, when you go, how long you stay, why you're going, what activities you have planned, whether they are work-related or otherwise, where you're staying, and your very own characteristics. So our first topic is going to be food and water safety. I'm going to start off with a question. Which of the following pathogens most commonly cause traveler's diarrhea? Is it A, parasites, B, viruses, or C, bacteria? And the answer is bacteria, such as E. coli. So this is a big topic, traveler's diarrhea, and I'm sure all of you have experienced this in your life. This is the most commonly occurring illness in travelers and usually occurs within the first few days to up to 2 weeks of arrival, and then the risk decreases thereafter. Pathogens are transmitted through food and water, and I won't recite the definition of traveler's diarrhea, but it's there for your information. The most common bacteria to cause it are E. tech, as well as other types of E. coli and Campylobacter. Traveler's diarrhea is usually self-limited. Symptoms last about 1 to 5 days, but if your symptoms persist longer than that or are accompanied by persistent fever, abdominal pain, or bloody diarrhea, or you're unable to tolerate POs, it's time to go seek medical attention. Here's a table which just goes through various different bacteria, viruses, and parasites that can cause traveler's diarrhea. We're going to focus a little bit on typhoid fever. So with regard to epidemiology, this bacteria is transmitted through the oral fecal route. It's found in many parts of the world, including Central and South America, as well as parts of Africa and Asia. With regard to clinical manifestations, it can cause fever, abdominal pain, and diarrhea. Treatment is effective with fluoroquinolones, azithromycin, or third-generation cephalosporins. And in terms of prevention, hand washing, avoiding untreated water, raw fruit, vegetables, or undercooked foods is important, as is vaccination, which we'll talk about a little bit later in the presentation. In terms of preventing traveler's diarrhea, what you drink is super important. So only drink bottled, boiled, or treated water and beverages. Make sure that the seal on the bottled water is not broken. Ice in drinks is not necessarily safe unless it's from boiled or treated water. And keep in mind that freezing and alcohol do not sterilize water. Make sure you wash your hands before you handle food and eat food. If soap and water is not available, it's important to use hand sanitizer with at least 60% alcohol. Also keep in mind that brushing your teeth, rinsing food, or washing kitchenware with untreated water could put you at risk. I find this table quite helpful. It's from the CDC, and it goes through the different methods of removing or killing bacteria, viruses, or parasites. So what I did was I circled 2 of the methods that I feel as though are the simplest way of doing so. So one is, of course, boiling, which will end up killing all of those different types of pathogens. Or you can buy a purifier, and this also removes those pathogens. So I'd advise that you just kind of take a closer look at this on your own time. A little bit more about prevention. So food selection is important. So consume fruit and vegetables that you have peeled yourself. Avoid undercooked meat and fish. Avoid unpasteurized dairy. Condiments can be contaminated if they've essentially been sitting around for a while, and that can happen anywhere, including here. And street food may be higher risk. The most important part of travelers' diarrhea management is rehydration with clean water. Anti-motility agents should be used pretty cautiously and definitely not to be used in bloody diarrhea. And antibiotics have a limited role, but if you do end up taking antibiotics because your symptoms are persisting, the recommendation is to take azithromycin. You can either take 1 gram once, or you could take 500 milligrams once daily for 3 days. And this is definitely recommended for all travelers to Southeast Asia, but it can also be used elsewhere. There are a couple recommendations here that I included. One is for rifaximin or for fluoroquinolones, but really azithromycin is first line. This table basically shows various different oral rehydration solutions and the different amounts of electrolytes that are contained in each of them. So you can see there they've included cerulite, enfolite, Pedialyte. So what I would recommend is that you just choose one, whether it's cerulite or Pedialyte, and just have a bunch of those on hand in case you need them. Next topic is vector avoidance. So super important, because a lot of the different countries that you'll be traveling to do have mosquitoes, and you want to make sure you do everything possible to prevent mosquito bites. So what do we do in terms of prevention? Again, I know a lot of you have traveled before, but never hurts to review these different methods. So sleep with bed nets. Make sure that the bed net doesn't have a hole in it and that you've tucked it really sort of well under the mattress. Use an EPA-approved insect repellent with at least 20% DEET. There's no need to use greater than 30% DEET on your skin. It does not increase efficacy, and it just irritates your skin. Keep in mind that non-DEET repellents, those, for example, that contain citronella or other natural ingredients, are not as effective as DEET. You can always use permethrin at 0.5%, which can be sprayed on clothing or bed nets, although soaking is preferred. These are effective for many weeks, even after washing. Important to wear loose clothing with high necklines, long sleeves, and long pants, and avoid bright colors and shiny jewelry and perfumes, etc., that may attract mosquitoes. If possible, stay in a home or a room with AC or windows that have screens. I know this is not always possible. And then in terms of prevention, of course, chemoprophylaxis, which we'll discuss in a few moments, is key. You've all learned about malaria, a parasitic illness which is transmitted by the mosquito and which is present in most tropical regions of the world. The clinical presentation can be fairly mild with fever and chills, but we all know that you can develop very serious complications, which can include cerebral malaria, anemia, and liver failure, which is why vector avoidance and chemoprophylaxis in certain parts of the world is so important. This is a map of areas in the world where malaria is endemic, and you can see that it's endemic in a lot of the countries where you'll be traveling, whether it's in South America, Africa, Southeast Asia, or South Asia. So let's talk a little bit about malaria prophylaxis. Keep in mind that it is not 100% effective, so important to seek medical attention if you develop a febrile illness during or up to 3 months after your trip. With regard to what to take, Malarone is usually what is prescribed. However, there are other options, so just discuss with your provider what makes the most sense for you. And also keep in mind, if you do develop a febrile illness that seems consistent with malaria and you're unable to be evaluated, you should have a low threshold for empiric self-treatment. You can either use Malarone, so it's going to be 4 tabs daily for 3 days, or Coartem, which you can find fairly readily in most places where malaria is endemic. We'll turn now to the Zika virus. So this is also transmitted by mosquitoes. In fact, the same mosquito that transmits dengue virus and yellow fever. There have been Zika virus cases in most countries in the Americas and many countries within Africa, South and Southeast Asia. Interestingly, about 80% of individuals who are infected with Zika are actually asymptomatic, whereas others might experience fever, arthralgias, a rash, or conjunctivitis. Most importantly is the association between Zika and congenital fetal malformations like microcephaly. So if you are pregnant or planning to become pregnant soon, important to avoid travel to areas with active Zika virus transmission. And I'll tell you where those areas are currently. Important also to know that infection with Zika virus is unlikely to affect any future pregnancies. And if you want to learn a little bit more about Zika, the CDC resource that I've provided here on this PowerPoint slide is quite helpful. This slide shows two maps. So the one on the left is a map of a current Zika outbreak, and that is in one state in India. That state includes the city of Mumbai, actually. And that outbreak has been ongoing probably since the spring or summer of 2024, and there were still cases earlier this fall. The second map shows the Zika geographic risk classification, and that's as of May of 2024. So in the darker blue, you see areas of past Zika transmission. The medium tone blue shows areas known to have the mosquito that transmits Zika, but no reported Zika cases ever. And then the paler blue delineates areas that are not known to have the mosquito that transmits Zika. Now we'll turn to dengue. So this is also a viral disease which is transmitted by mosquitoes and is present in parts of the Caribbean, Central and South America, the Western Pacific Islands, Australia, Southeast Asia, and Africa, and now, interestingly, California. Symptoms usually begin about 4 to 7 days after a mosquito bite, and those symptoms generally are mild, include myalgias and bone pain, joint pain, fever, headache, rash, but as you well know, there are quite serious complications that can arise, including shock, hemorrhage, and death. This is a map of dengue as of September 2024, and in purple are the countries that are reporting higher than usual numbers of dengue cases. So you can see that these cases are basically in Central America, South America, parts of Africa, and parts of South Asia, as well as Southeast Asia. We'll turn now to yellow fever virus. So this is also a virus that is spread by mosquitoes, and it's found on 2 different continents, so South America and various different countries in Africa. The clinical presentation can be incredibly serious with hepatic dysfunction, hemorrhage, myocardial injury, CNS dysfunction, and even death. This is why prevention with both the yellow fever vaccine and avoidance of mosquito bites is so important. We'll talk a little bit about the yellow fever vaccine a little bit later in this talk when we talk about pre-travel immunizations. So that's our topic now. Let's talk about pre-travel immunizations. So these are grouped into 2 categories, the first of which is routine immunizations. Many of you are probably fully up to date with these, but just double check, because sometimes 10 years passes and you don't even notice and you're suddenly not up to date with your Tdap, for example. And then polio is another one. Just double check that you don't need a one-time booster of IPV if you're traveling to an area with increased risk of polio. In terms of country-specific vaccines, so we'll talk a little bit about the typhoid vaccine as well as yellow fever and the rabies vaccine. Keep in mind that for Japanese encephalitis, if you are traveling to a country where that is endemic, you may need this vaccine. It just all depends how long you're staying and where you will be traveling within that country. So talk to your provider about that. So we're going to talk a little bit about typhoid fever vaccine. So there are 2 forms, the first of which is the inactivated injectable vaccine, which here the immunity lasts for 2 years. And then there's the live attenuated oral vaccine. This one actually was off the market for a while, but just came back on market about a year or 2 ago. That immunity lasts for about 5 years. It's not recommended for immunocompromised or pregnant individuals, and its effectiveness is reduced by concurrent malarione, so keep that in mind. The yellow fever vaccine is a 1 lifetime dose. It may be required for entry into some countries in Central America, South America, Africa, and Asia. Some countries may require proof of vaccination prior to entry if you're arriving from a country which was known to have yellow fever. And this even can sometimes include layovers, so really keep that in mind. And proof of vaccination must be provided on an official international certificate of vaccination or prophylaxis card, this yellow card, which you can see here on the right. And for anyone who needs a waiver if the vaccine is contraindicated, has to have the medical provider fill out a medical contraindications section of the yellow card and then write a waiver letter. So whether or not it will be honored, is not necessarily guaranteed. So confirm it with the immigration authorities before you travel. These two maps show regions where there have been cases of yellow fever, and in yellow are the areas where vaccination is recommended. So you can see the map on the left is of various countries within Africa, and then the map on the right is various regions of South America. So in Brazil in particular, there was an outbreak in 2016 through 2018, which is why so much of Brazil is included in that yellow fever vaccine recommendation. And these maps were last updated in November of 2022. Next, we'll turn to meningitis vaccines. So if you are traveling between December and June in any of the countries that lie in this meningitis belt, it is recommended that you receive the quadrivalent meningococcal conjugate vaccine. The Global Health Program has put together a COVID-19 travel framework, which mirrors the current recommendations at UCLA for any healthcare worker who is symptomatic or COVID positive. Before you travel, please make sure that you review any COVID-19 country-specific travel guidelines. Most of these have been dropped since the height of the pandemic, but you never know if there are some new guidelines that pop up, so please just make sure you do that before you leave. I'd also review the PPE resources in country and plan for PPE while performing your clinical duties, but just be very aware of the burden of resources in host countries and equity among your local colleagues who may or may not have the types of supplies that we have here. We do recommend vaccinating yourself against COVID, and then also recommend wearing masks during travel to protect yourself and others. If you have a suspected or confirmed respiratory viral infection, you should do the following, regardless of whether testing is performed. You should not return to work until at least 24 hours have passed with no fever, symptoms are improving, and you feel well enough to return to work. You should wear a face mask in all patient care areas for at least 10 days after symptom onset or positive test. Practice frequent hand hygiene, and if you do test positive for COVID-19, you should wait until at least 3 days have passed since symptom onset to return to work. Just a reminder that day 0 is symptom onset, and so the soonest day you could return to work is day 4. Next, we're going to discuss a little bit about occupational exposures. The best prevention is, of course, avoidance of exposure. So how does one go about doing this? Firstly, is to use universal precautions. Do not do any procedures without supervision or if you're feeling uncomfortable. And really importantly, bring your own gloves, eye protection, and masks, including an N95 if you can. As you might imagine, a lot of our partner institutions don't necessarily have enough resources to go around, so you can avoid any issues if you bring your own supplies. And then lastly, don't be afraid to ask for help ever. If you do experience an exposure to blood or body fluids, the first thing to do is to wash the skin with soap and water, cleanse with an antiseptic such as alcohol-based hand hygiene agent, flush any exposed mucous membranes with lots and lots of water, and if there is eye exposure, irrigate with saline or water. I'll let you all read this on your own time, but briefly, this slide describes the CDC definition of any exposure to blood, tissue, or other body fluids that may pose a risk for HIV infection. So please take a minute or two to read this slide. So when should post-exposure prophylaxis be started? Ideally as soon as possible and definitely within 72 hours of exposure. And the next slide will describe what to do in the case of exposure and next steps to take. So what do you do in the event of an exposure? So here we've outlined the different steps in this process. Number 1, following possible HIV exposure, flush and wash exposed area with water and soap. Number 2, call your local supervisor as well as the GHP faculty line. Here's the number for you. If the decision is made to start post-exposure prophylaxis, take your first dose as soon as possible within 72 hours of the exposure. Baseline testing for you and for the source patient should be undertaken. Of course, if it's not possible to do that, we understand. Then when you come back upon your return, please call UCLA Occupational Health. Here's the number for you for an appointment and follow-up testing at 4 to 6 weeks and at 12 weeks. If you can't reach a GHP faculty member, please start PEP ASAP and no later than 72 hours after exposure. Down at the bottom of this slide, you can see the recommended regimen, unless you're pregnant in your first trimester or trying to get pregnant, and that regimen differs a little bit. With regard to TB prevention and exposure, always wear an N95 mask if there's any risk of TB exposure. And if you do experience a potential TB exposure, contact your local emergency contact and email our GHP faculty email within 24 hours. Once back at UCLA, call Arthur Ashe Student Health and Wellness Center, and the phone number is right here, to make an appointment for baseline and follow-up testing. So now we're going to turn to environmental exposures and other travel health. So sun and heat. I think you all are quite aware, living in Southern California, that you should wear a hat and sunscreen to mitigate the risks of sun exposure. Dehydration can creep up on you, so very important to stay hydrated, particularly in humid tropical regions. Humid weather can actually mask dehydration, so please just drink fluids and keep potable water on hand always. So this is the fun slide. So this is for any of you who are planning on hiking or climbing or scuba diving or swimming. Just need you to be aware of the different risks involved. So high altitude illness is an entity that includes acute mountain sickness, which can happen over 6,500 feet, as well as high altitude cerebral edema, which can happen over 9,800 feet, and high altitude pulmonary edema, which can occur over 8,000 feet. The best way to mitigate the symptoms of high altitude illness are to participate in a slow ascent. If this isn't possible, or you have any underlying health risk factors, then you should consider getting a prescription for prophylactic medications. So for acute mountain sickness or high altitude cerebral edema, acetazolamide is the medication of choice for prophylaxis and for treatment. And then for high altitude pulmonary edema, and this doesn't happen very commonly, the medication of choice is actually nifedipine. In terms of scuba diving and swimming, so it's recommended that you avoid flying for 24 to 48 hours post-dive to avoid decompression sickness. Always swim or dive with a buddy, and try to avoid swimming in fresh water where there may be schistosomiasis. We've talked a lot about vector avoidance, but what we haven't talked about yet is animal bites and what you do. So just so that you're aware, we have had a few students and residents who've been bitten by dogs or who've had exposures to bats when they've been on various clinical electives. The issue there is that if there's no local rabies post-exposure vaccine or immunoglobulins, you'll need to be evacuated. So that makes it quite important to discuss rabies pre-exposure vaccine with the provider that you'll be seeing for your pre-travel consultation, so that you're aware. For those of you who go to ASH, UC SHIP insurance actually does cover this vaccine. So avoid all animals, even pets, because you just don't really know if they've been vaccinated. If you're bitten, scratched, or stung, please wash the wound immediately and seek medical care. So air travel obviously confers a risk of venous thrombus embolism, and the longer the flight, the higher the incidence of various different VTE events. So that risk actually remains for up to 8 weeks after travel and is increased in patients who have underlying risk factors. So if you do experience any kind of leg swelling, pain, redness, or warmth, or any shortness of breath and chest pain after you've been on a long flight, please seek medical attention. So what can you do to prevent VTEs during air travel? Frequent mobilization, proper hydration, avoiding sedating medications or alcohol that'll make you sleep during the entire flight. You should use compression stockings, and you should definitely just get up as much as you can and flex and extend your ankles and knees. Jet lag is obviously something that we've all experienced. It can cause sleep disturbances, daytime fatigue, GI issues, and reduce your productivity. So, what can you do to mitigate all of that? So, you can adjust your schedule to the local time when you arrive. Light exposure is super important. And then melatonin has been shown in some studies to be beneficial. It's definitely more effective when you travel east, but it can be beneficial for westward travel if you're crossing more than 12 time zones. So it's important to talk about injury. To put this in context, an estimated 18 to 24% of deaths among travelers in foreign countries are caused by injuries, actually, and only 2% of deaths are caused by infectious diseases. Motor vehicle crashes are the number one killer of healthy U.S. citizens overseas. So you can actually see this in this bar graph where road traffic events are the leading cause of injury death for U.S. citizens in other countries. And this data is from 2015 through 2016, but it seems to hold. So with that context, I wanted to discuss road safety a little bit. So it might be inevitable in some cases that you have to rent a car or ride a motorbike or take a minivan, public transportation. But if you could try to minimize that, that would increase your safety. Wearing seatbelts obviously is encouraged, helmets if applicable, and really think about the vehicle that you're getting into before you take that ride. Try to avoid driving at night. Obviously, don't drive under the influence of alcohol, drugs, or sleep deprivation, which sometimes is the latter of which is difficult. Become familiar with local driving laws and conditions, and be aware that many countries use manual transmission vehicles. So if you know that's going to be the case, maybe try to practice a little bit before you leave. Crime and violence are also important for us to discuss. So review any travel advisories on the State Department website, and please enroll in the Smart Traveler Enrollment Program, or STEP, and do everything possible to mitigate the risk of injury, assault, or sexual violence. So what does that mean? Well, assess the risk at your destination before you leave. Travel with a companion if you can. Limit travel at night. Limit your alcohol intake, and really think about local customs and etiquette and dress. Avoid wearing anything that's flashy or expensive in terms of clothing or jewelry. Again, take only recommended and safe modes of local transportation. If you're actually confronted in a robbery, please just give up all your valuables and don't resist. And finally, be aware of local laws, which might be different from those that you're used to here in the US. I'd like to touch upon the challenges that LGBTQ plus travelers may face while traveling abroad. Super important to familiarize themselves with local laws, cultural attitudes, and tolerance, as these can definitely vary between countries and different parts of the world. There's a pretty decent resource on the Department of State website, which I've included down at the bottom of the slide, that you can review. And then on the right-hand side is a map from the Council on Foreign Relations from a few years ago, which shows and illustrates some of the protections, for example, for same-sex marriage in various parts of the world, or the lack thereof in other parts of the world. You will most likely not have to worry about anything that's on this slide. That said, there are a few points we wanted to emphasize to prepare you for your re-entry into the U.S. So one is that Customs and Border Protection has search authority that extends to electronic devices. Therefore, be sure to consider what content is on your electronic devices in advance of your arrival. Leave copies of important documents with a trusted person. Communicate with that person as your turn with the customs officer approaches. Have your phone, charger, water, a warm sweater, and snacks with you in your carry-on in case of any secondary questioning. And importantly, memorize trusted contacts' phone numbers and write them down on a piece of paper, and keep this information with you at all times. Again, hopefully none of this will be an issue for you, but we just wanted to make sure that you prepared yourself for any re-entry. So, a couple points on emergency preparedness. So, there are a number of things you should always carry on you at all times. These include a copy of your insurance card, as well as the phone number, any vaccination cards you might have, the contact information for the nearest U.S. embassy or consulate, the contact information for local and GHP emergency contacts, as well as any emergency protocols that we've provided you with. And please always carry a copy of your passport and itinerary. A couple other points that we wanted to emphasize were that you should always research how to access healthcare anywhere you are. I'd recommend packing a health kit with supplies for common ailments, as well as your own medications if you have any. Please bring an extra battery in case of power outages. This can be an issue in South Africa in particular because of load shedding. And then importantly, please reach out to the local contacts that we've provided you with for guidance prior to finalizing any housing. You want to make sure that you've chosen housing somewhere that is safe, and the best people to kind of guide you in that are the local contacts. So let's turn to travel insurance. We all hope you won't have to use it, but incredibly important to have it. So once your flights are booked, Vegeta will actually forward you a welcome email from UCLA. It has kind of a funny spam-like address, but she will be sending it to you, so you don't have to worry about that. And that email is really important because it contains the link to print and download your insurance card. You can see a copy of that insurance card and what it looks like down at the bottom of the slide. It also contains the link for registering for a World Q account. And that World Q actually comes in the form of an app that you can download and you can turn it on, and I'll kind of show you what that interface looks like in a couple slides. And once you receive this email, important to program the Chubb AXA number and contact information into your phone, and make sure you also carry a hard copy of that card. So UC Travel partners with a travel insurance company called Chubb AXA Global Medical and Travel Assistance Program. So this illustration shows you the different types of services that this insurance company provides. And so they fall under two categories. One is medical assistance. So if you have a medical issue or if you need to be evacuated, those services fall under that category. And then there's travel assistance. So for example, if you lose documents or luggage, or there's a political or natural disaster, you can be provided assistance for those types of issues. So if there's one thing that you should retain from this presentation, it's the emergency protocol that we've put together. So this is for any medical or non-medical emergency. So if you have a medical emergency, please seek immediate care at a medical facility and then call Chubb AXA Global Travel Assistance Program, plus minus use the World Q app, which I'll show you in a couple slides. So you'll have the number for that travel assistance program plugged into your phone, as well as a hard copy, hopefully. They are available 24/7. We've actually tested it out. We've had students use these services and they work and they are efficient. And third, contact your local emergency contact and email us at the GHP faculty email. And then fourth, and again, this is just for emergencies, please call the DGSOM Dean's Office emergency line, which is also, the number is provided here as well. So for non-emergency protocols, whether they're medical or non-medical, an example might be that you've had diarrhea for over a week and you took your azithromycin and you're still just not feeling very well and feel a little bit dehydrated, but it's not an actual emergency. This is what you would do. So first, you would call Chubb AXA Global Travel Assistance Program. Again, it's available 24/7. They will actually refer you to a local provider that's been vetted. They also may offer a telehealth consultation if that's a possibility. If you need any mental health counseling, that is also available, which is actually quite helpful potentially. Or you can check the World Q app and you can do a medical provider search, and you'll also be provided with a list of local vetted providers. The second thing you do is to contact your local emergency contact as well as the GHP faculty via their MedNet email. So this just shows you the different ways of reaching the Chubb AXA travel insurance program. So, of course, there are the numbers, and you can call from outside the US or within the US. You'll have your insurance card, and then there's actually also an email that you can email them at. And then on the right hand side is what the interface with this WorldQ app looks like. There are 3 buttons. So one is a crisis button. So you can actually use this button if you need immediate text assistance during a dynamic security event and can't speak on the phone. And then if you can speak on the phone, then you would use the hotline button. And that actually connects with the University of California's 24/7 hotline center. And this is again in the event of some sort of emergency. And then the third button is the check-in button. And this is basically just a button to communicate that you're safe during any kind of dynamic security event. So what are your next steps? So if you haven't already, please make an appointment for a travel consultation, whether it's with ASH or your own PCP. The GHP will purchase your plane tickets and you'll automatically be registered for the Chubb AXA Global Travel Assistance Program. As I said before, you'll be emailed probably by Vegeta, and please open that email so that you can access everything that you need in terms of travel insurance, whether that's your card or the information about downloading the WorldQ app if you choose to do that. If you are traveling to a State Department Travel Advisory Level 3 designated country or region, GHP will actually arrange for a security briefing for you with UCLA Risk Management. And then lastly, please register for Smart Traveler Enrollment Program, or STEP, at this State Department website here. And this is a really good program that allows the State Department to locate you in case of an emergency. Here is a list of different UCLA resources that you can take a look at, but it includes our GHP faculty email as well as the DGSOM's Dean's Office emergency line, the pre-travel visit ASH Student Health website, the UC Travel Insurance and Evacuation Insurance website, as well as some information for the Behavioral Wellness Center in case you're having a mental health issue while you're away. And then hopefully this will never be necessary, but there is also support for those who have experienced any sort of sexual assault or violence, and that comes in the form of the UCLA Rape Treatment Center, or the RTC, which is available 24/7, and you can see a little bit about their services on that website provided here at the bottom of the slide. And I hope this was helpful, and please email me at cgallup@mennet.ucla.edu if you have any other questions. Thank you.